Dr. Lee, we talked about, cosmetic dentistry, restoring, and we touched a little bit on orthodontic treatment. Go ahead. Invisalign has become so important or so famous. Not so sure whether it's become important, but definitely famous. So tell us a little bit about Invisalign. Why is it so popular these days?
Invisalign has become real popular because people don't want to necessarily wear brackets, braces, and wires on their teeth. They want a solution where when they go to the office meeting and they're presenting something, they don't have to worry that people are staring at their teeth. It offers a nice solution for those people who have jobs or situations where they need to look more presentable, and for them, they feel that.
Tell me, Dr. Lee, are the Invisaligns really invisible?
You can still see them a little bit. It's a clear plastic tray that goes over your teeth. But, for a lot of patients, you're not going to really notice a lot. And if you do notice it, it's not going to be too obvious.
Great. What about the treatment? I mean, what advantages does it have there versus the traditional wires and braces? It allows us to control movement on certain teeth. So if we wanted to move one tooth here, we can have that control because we do, the company, they use a sophisticated 3D software that allows us to dial in changes. So if we wanted to leave everything else alone and just move that one tooth, we could go ahead and do that. With the brackets and wires, we have to constantly think that if we make one change to the bracket or wire or something, then all the other teeth we have to take into consideration. Interesting.
So, for some patients who, we might do Invisalign before cosmetic work, we might say, we want to move just this one tooth, or we might want to create some spaces between certain teeth. It allows us to get some freedom with that. So we can combine Invisalign with cosmetic dentistry and give, certain outcomes to the patient that they might like, and they don't end up having to wear full braces.
And lots of adults are using Invisalign, but also the normal teenager, yes or no?
Yeah, a lot of teenagers are, I think braces are still more common with teenagers. But a lot of teenagers are starting to move towards Invisalign. A lot of adults, we have patients in our 60s that are doing Invisalign. Wow. Because Invisalign, it's getting your teeth straight. It's not just cosmetic. People who get their teeth straight, tend to have less periodontal disease, gum problems, or they start to get less cavities around their teeth because they're not crooked and they can clean them easier.
Let's talk about the Invisalign. So when you have those trays, how many of them you have? About 20 or so, I heard, or it depends, I guess, on how crooked the teeth were in the first place.
Right. It'll depend on. It'll be case dependent. You can have as little as 5-10 aligners, or you can have 30-40 aligners. It just really depends on the case.
Good. And what do? You change them like every couple of weeks. And by doing so, just keep moving forward towards where you want to go with your teeth?
Right. Yeah, every 2 weeks you're going to go ahead and just change your aligner, and that's going to go ahead and put a little light pressure on the teeth that are trying to move. So we might give you, enough aligners to go 4 or 6 weeks at a time, so we can so you don't have to keep coming in for adjustments. We just keep on handing you trays and make little adjustments to your teeth as necessary.
What about if a person loses an aligner for some reason,
If they lose one, we can go ahead and call the company. They can go ahead and ship us the one that they've lost.
Good. Now, and I think the reason those Invisaligns have started off not being so popular with the children is because every time you eat, you take them out and then you put them back in. And you brush your teeth before you put them back in. So basically nothing changes in the mouth there. But, some maybe, young boy, young girl, school lunch, chasing the girl, chasing the boy. Next thing you know is they don't put it back in.
But as you said, a responsible child and teenager, will probably do it. But anyway, the point is you take them out during eating, correct? All the time.
Yeah. Eating and brushing, you have to take them out. Kids and teenagers that have a little misalignment with their jaws because they're not growing properly, Invisalign might not be the best option for them. So, just like with everything, we want to evaluate the patient properly, give them their options. So, if they are a candidate for Invisalign, we can offer that to them. So, it's a little bit easier to clean around them because you can just take them out and they're just your own teeth there.
All right, so you don't have the spinach hanging off the wire.
Right.
Like a flagpole. And also, like I have heard, tell me whether that's true. Here's what some dentists and some orthodontists are saying. The braces you have beautiful after a couple of years, the average case, whatever, year and a half, 2 years, you have a beautiful straight mouth. Then you take off your braces, and next thing you know is, however, you have now gum disease, because if you didn't brush, which is very difficult brushing with the braces, much more difficult than normally, a little bit like with a crown and a bridge. You need to really be dedicated. So if a person wasn't dedicated, he will have now gum disease, which is, of course, in my opinion, based on what you said, a lot worse than having even crooked teeth, because it ruins your health. Or even where the braces were on it, the little brackets, there are like white, yellow kind of spots. Is that true? Have you noticed that?
Yeah, well, if you're a teenager, just anyone who doesn't take care of their teeth well with the braces on, they're going to tend to get more food and plaque around their teeth. And as a result, the gums will go ahead and take a little bit of a beating. They're going to get swollen. They'll start to bleed a lot more. Patients with Invisalign, they're able to clean their teeth better, so they tend not to get those problems as much. But of course, if they still don't take care of their gums, they still won't, they'll still have those problems. The white spots around the brackets, that's becoming a little bit less frequent. Some of the cements that we're starting to use with our braces, they help prevent those problems. And we also like to supplement the braces with a special paste that we use that helps to keep the teeth a lot stronger while they're going through their treatment. So, as time goes on, we're starting to learn a lot of things and trying to help the patient. So, we know that there are certain problems and we're trying to prevent them as much as possible.
Sure. Well, as you said, there's no one glove fits all. Now, if let's just say you have this adult, or teenager for that much, but let's say an adult, and he wears the Invisalign, and he has this all-important job interview or this all-important first date, and if he every so often, not too often, for such an occasion takes the braces out, will that be the end of the world or not really?
Are we talking braces or Invisalign?
Invisalign, of course. I mean, he can take out the braces, I think, but that, kind of on an Invisalign. So, he has them, he got used to it, but he's a little self-conscious, has that date or has that job interview, and he says, look, for that next 2 hours, I take it out.
Well, 2 hours isn't going to be the end of the world. We don't want you to leave it out a day at a time, but a couple hours probably won't hurt. Some people do take a little longer to eat, so we kind of consider that. Now, if you're Italian, you might take 3-4 hours to eat. If you're a business executive, you might take 10 minutes to eat. You never know. So we usually recommend you keep the liners in for about 18 to 22 hours a day at least. The longer they're in there, the better they're going to work. So that's why we have you come back. We monitor the movement of the teeth. So once in a while, we might have you wear that liner a little longer than 2 weeks just to kind of balance what's been going on with that individual patient.
Got it. I can, however, think of a very, very big disadvantage of the Invisalign. You want to know it?
What is it?
You can't put any, favorite football flag on it on the little thing, You can't put, you cannot be a patriot towards your team, your school, or something like that. You know,
you can always get a marker.
I guess so. I find them cute. I've seen some kids running around with them, you know, and they have this like, oh, what's that? And they go, oh, that's the Lakers, you know.
Yeah. A lot of kids have fun with it, and you know, even adults. You know, not one product is made for everybody, and there's plenty of adults out there who they're fine with wearing braces also. You know, everything has their advantages and disadvantages, and we'll go over that with the patient, and if they want to do braces, we do that. If they want to do Invisalign, if they're a candidate, we could do that for them.
Right. Well, because even the braces, they have become, you know, now clear braces. They're like much more ceramic. They're not so much metal.
Right.
They're not anymore that like metal, silver kind of like yuck coming out thing in the first place, right?
Yeah, so we have, you know, we can also do ceramic braces for them if they're a little bit more conscious, and you don't really see those as well. So, you know, we have those options for the adult who they might really benefit from braces more, but they just don't want the look of braces.
So they go with ceramic braces, maybe a tiny bit more expensive, but there it is.
Yes.
You know, for that year or two, whatever they need it, it looks not quite as bad as the other ones. Thank you very much.
Right. Thank you.